Hey, it's John Butler, JB Benefits Consulting. Thanks for joining me here today. Let's get right into this. I'm a veteran of the insurance industry. I've worked in that business for 28 years. I actually sold my brokerage firm in 2023 to go independent. I am the author of this book, Health Insurance Sucks, The Moral Case for Better Business Healthcare. And after almost 5 years of research and development, I'm proud to introduce to America something I call the Cafeteria Plan, a once and for all fix to business healthcare. Now, I call this a cafeteria plan for a reason. I wanted the analogy to be like a cafeteria restaurant. But instead of going in there and having a tray and getting food, the concept is your boss is giving you money for your tray and you are picking and choosing and designing your own healthcare off the shelves. You own it, you control it. So that's what this is about. Now, this one is specifically for 50 to 500 employees, so keep that in mind. Traditional health insurance, I found out from all of my research, is fundamentally a flawed system and actually, in my opinion, a sinister system. Why is this? I found out that you are actually running a mini health insurance business inside of your business, no matter what kind of business you have. Now, what do I mean by this? Well, when you start an insurance plan, first year, you realize the expenses are pretty high. The truth is, it's the second or third largest line item on a profit and loss statement for most businesses across America right now because of this system. So you start the program, the costs are high right away. The second year comes and the system continues. A few of your employees have bad claims and all of your employees' rates go up all at once. So if you're a company of 100 employees, you probably know this already. Just a few of your employees can have bad claims and impact your rates for the following year. Your broker delivers this renewal in year 2, and it's not a bad claims year, but your health insurance rates did go up 6%. But then the third year comes, and your mini health insurance plan system implodes on you. You find out from your broker about 3 months before the end of the year that one employee has cancer, another one is in the hospital on dialysis because of his diabetes, and another gal, an employee of yours, just had a premature baby, and that baby is in the hospital under 24/7 care. By the way, those claims of premature babies are $1 million claims on average. But your broker delivers your third year health insurance renewal and tells you your rates are going up 27%. Now, if you're a company of 100 employees, on average, you're spending about $1.4 million each year for your health insurance plan. A 27% renewal increase means your health insurance plan is going up another $380,000 just next year. Owning health insurance means you're trapped in their system. Health insurance companies dictate to your business future premium pricing for all your employees. So you have a few employees that have bad claims, everybody suffers. The collective insurance claims of all employees are calculated into your increased premiums you pay at the year-end renewal time. But this is a little known fact. By owning the health insurance contract, you're locking out your employees from buying individual health coverage in the marketplace. I wanted to find out how expensive the individual rates were in the marketplace and what other alternatives were for individuals to buy coverage in America. Many companies don't even know that they can allow their employees to own their own coverage, and it's actually a law that was passed almost 5 years ago on January 1st of 2020 that allows your employees to customize their own insurance, get it and own the coverage, and then you, the employer, can reimburse them tax-free. But why don't more brokers offer this alternative? Well, this is relatively easy if you think about it. If I'm a broker and I'm handling your company of 100 employees here, it's much easier for me to sell you one contract. Claims or no claims, we can put in different deductible choices for them to choose. You set an amount that you're going to reimburse them, and you're on your way. It doesn't really require that much work. Most brokers around the country are not staffed up to handle this kind of thing because they would have to customize coverage for all 100 of your employees and their families. That is a ton of work. What I wanted to do is go back and study this thing from a trends perspective, because I think if you recognize trends going forward, you'll be able to see what's on the horizon here. So I went back and studied the individual marketplace, and here's what I found. Over the last 5 years, from 2020 to 2024, individual health insurance enrollments have gone up 100% from 11.4 million in 2020 to 21.3 million in 2024. And there's a little known thing out there in the marketplace called health sharing. Health sharing exists and has existed for the last 30 years, but it's done the same way that health insurance is done. It's just outside the system. So health sharing companies take in basically monthly contributions, just like health insurance takes in premiums. There's a big pool of money that they build up, and when claims happen, they pay the claims out, just like health insurance companies do. That trend across America, I found out in the last 5 years, is up 75%. Let's find out why that is. Health sharing for employers has just come into existence in the last 10 years, but it's been around, like I said, for 30 years. So outside the health insurance system, I'm showing you a plan that actually is the most expensive health sharing plan that I have within my company. But the $1,500 initial unshareable amount is similar to a deductible on a health insurance plan. But that's the only cost you pay. The health sharing plan pays the rest after that claim happens. But here's the rates: under 30 years of age and over 30 years of age. But this is very similar to your group insurance plan. You have an employee only, an employee plus spouse, an employee plus children, and an employee plus family rate. Now, these health insurance rates for a traditional plan around America right now are $700 a month for an average traditional employer plan. This rate is $233 for 30 years of age all the way up to 65. Here's a family rate of $698. The average around the country right now is $2,000 per month for the average family. So you can see how much more reasonable that these rates are compared to the health insurance rates around the country. Now, health sharing candidates must consider their past history of pre-existing conditions when applying for coverage. That's one caveat on health sharing, but we offer health sharing and health insurance side by side within the Cafeteria plan. I'll tell you more about that in a bit. I want you to take a look what it's like inside the system and then the Cafeteria plan outside the system. But this is an example of a company that pays 100% of the employee's premium. The group insurance plan they have is a Blue Cross plan with a $3,000 deductible and then an out-of-pocket max after that. For a single, it's $9,000. For a family, it's $18,000. Here's the breakdown from an employer and from an employee standpoint. That single guy pays nothing because you pay all of his premium. The single gal with 2 kids, you pay $720 of hers, but out of payroll deductions, she pays $640. That total for her is $1,360. And this family of 5, that total premium for the family is $2,260. You pay $720, and that family pays $1,540 out of payroll deductions. Now let's look at outside the system. The individual insurance marketplace now you can buy any time of year. It used to be restricted to year-end enrollments for just that open enrollment period, but that's not the case anymore. So individual insurance can be bought in the open marketplace. I'm using the same exact Blue Cross Blue Shield plan with a $3,000 deductible and the out-of-pocket maximums being exactly the same. By the way, there's no health questions asked when people switch from a group plan to an individual plan. They cannot by law ask any medical history questions. But in my state of Minnesota, these premiums look like this: $598 for that single guy who's 60 years old, $882 a month for this single gal with 2 kids, and a little over $1,800 for that family of 5 compared to the $2,260 up here. But let's go down now to the second tier of the Cafeteria plan. Let's look at the health sharing option. Health sharing, like I said, has a $1,500 initial unshareable amount. That's what IUA stands for. But there's no out-of-pocket max after that. They pay the first $1,500 and the health sharing company pays the rest of the claim. Here's what the rates are for that single guy, that single gal with 2 kids, and that family of 4. Now, the Cafeteria plan is designed to allow employers as much freedom and flexibility to reimburse their employees the way that they choose to do it. So in this particular case, you can choose to reimburse the entire monthly amount for health sharing. If they choose health sharing in the marketplace, they have no premiums whatsoever to pay or no monthly amounts. In the case of the individual insurance, you can also pay what you want, but I'll come to that in a second. What I wanted to show you here is a traditional group insurance plan. And like I said, if you're a company of 100 employees, you pay on average about $1.4 million in premiums. In this particular example, I've showed the employer paying $1 million of those premiums and the employees paying the $400,000, the rest of it. In the Cafeteria plan, when we give them a choice of individual insurance and health sharing, we can bring that premium down significantly. In this particular case, we cut it in half, a 50% overall savings. Now, what we've done here is brought this down, and it's obviously within the $1 million you already spent. But what I'm going to show you here is a path towards a zero premium, zero deductible program for all your employees with a guaranteed 100% flat budget for your business. Now, remember, if you were that company of 100 employees and you had a $1.4 million premium and you got a 27% increase on your group plan, you're faced with $380,000 more just next year. This program, the Cafeteria plan, that increase can never happen again because they don't lump your employees together and calculate the claims. The individual employees own the health insurance and the claims are paid by either the health insurance companies or the health sharing companies. It's completely outside of your business. Now, in this particular case, you have a $300,000 windfall here. Now, you can give your employees raises, bonuses, you can increase their 401k match, you can do whatever you want. You don't even have to do what I'm going to suggest here in a second. But if you want to pay the same amount and have a zero premium, zero deductible offering, you can take that $300,000 and dump $3,000 into everybody's HSA plans, which they will have a card, a swipe card to go in, and it will cover that entire deductible that I showed you before of that $3,000 Blue Cross plan, won't it? So you drop $3,000 into all 100 employees' swipe cards, and you will get a zero premium, zero deductible plan. Let's take it to the next step. The Cafeteria plan has taken me almost 5 years to develop, and it's a coordinated new system for any company interested in breaking free from the madness that traditional health insurance provides. We have 5 separate categories here. We design the program, which is very critical. We want to say, are you offering health sharing? We design it that way. Do you want to pay all the costs for the health sharing? We design it that way. How much do you want to pay on the health insurance side? How much do you want to reimburse? Do you want to reimburse the whole thing? You don't have to, so you're free to do whatever you want, but the design is critical. Then it comes down to education, where we educate both your HR team and your employees on this entire system. Your HR team has a dashboard where they can see your whole cafeteria plan month by month, your contributions, your employee contributions, where they're covered, and everything else. Number 3, enrollments. All enrollments are done electronically now. Technology has caught up to this in a major way in the past 3 to 5 years. But whether they decide to choose individual health insurance or health sharing, it's on the screen, it's online, they pick and choose exactly what they want, and then we just hit enter and they're enrolled in the program. Number 4, administration. This is another thing that's really come forward quite a bit in the last 2 to 3 years. Our third-party administrators actually allow you to just pay one check to that third-party administrator, just like you do with your carrier right now, and they send it along on behalf of all of your 100 employees electronically to the health insurance companies, so your employees don't even have to have their checking accounts invaded or anything like that. This is literally designed to make sure it's done for them. So it's easy to enroll, it's easy to administer. Last one, number 5, is compliance. It starts and ends with compliance with me. It's got to be compliant with all the rules and regulations regarding the systems, okay? But we review all plans with our ERISA attorney firm, which actually has helped me design this plan over the last 5 years. And lastly, and probably most importantly, I've just gone through a lot here. I understand that. It takes 90 days to convert from a traditional plan to a cafeteria plan. But there's a lot to this, isn't there? Well, we provide a quarterback that coordinates a done-for-you program. So our quarterbacks know the design systems, the education systems, the enrollment systems, the administrative systems, and are connected to our ERISA attorney firm to make sure it's all compliant and buttoned up for you. The Cafeteria plan disconnects your business from the health of your employees. It doesn't make sense for you to be connected to the health of your employees, does it? Then you'll be free from the rules and regulations that keep driving up your costs every year. Your business has a set budget that you control and is guaranteed flat. Employees design and choose their own health insurance plans or health sharing plans. Big savings for both you and the employees, and your business leverages your reimbursement dollars much more effectively than you could on that traditional plan. But the last check mark is the most important one in my world. I used to deliver renewals for companies for 28 years. The health insurance companies never gave me a very good reason of why these rates are going up. But your business will never ever have another health insurance renewal at the end of the year saying your collective employees' rates are going up. That's a big deal in my book. At the end of the day, the Cafeteria plan gets you out of the business of healthcare, allowing you to focus on what you've always wanted to focus on, your business. Thanks for joining me here today. I'll see you on the other side.